The transmission of flu is predominantly by respiratory droplets, so things that we cough out that people inhale or touch. Can also spread influenza by contact with surfaces and hands, so hand washing and those sorts of things are important. Then of course in the hospital environment we can also have transmission between patients and staff and patients, and that hospital transmission is an issue. I think the reduction of transmission by healthcare workers falls into a couple of areas. The first is getting vaccinated before the influenza season is on us. So vaccination, for example, March, April, May, before the flu season in winter, will reduce the transmission in the hospital environment and indeed in the community. The other area where transmission can be reduced is during the influenza season, and indeed at any other time. Particular care is taken with hand washing, with cough etiquette, mask use, all of those sorts of things that the infection control practitioners in the hospital tell everybody about.
The influenza and illnesses like that which fit people tend to tolerate often really makes someone who's got some other problem like a heart failure or a bit of kidney failure or something can often just be too much and they end up critically ill. So certainly in the intensive care we see in every winter we see influenza admissions who've got a nasty viral infection that affects the lungs, but also other organ systems failing as a result of the stress of the infection. And in 2009, as everybody would remember, the critical care structures of Australia nearly collapsed under the weight of the swine flu epidemic. Well, unfortunately, we're all a little bit exposed to the infections that we deal with, and no matter how hard we try, there's still a small risk of us acquiring infections from the people we look after, and there's no doubt that you can catch flu at work. In fact, the transmission at work is probably mostly between staff rather than from patients to staff, and sadly, often from staff to patients, and that's why vaccination is just so important to try and control that dynamic.
Yeah, the flu is a very serious illness in children. People tend to think of it as being associated with adults, but it can be very, very serious in children. The flu sends somewhere around 10% of children to the ICU, of those children who are hospitalised every year. Of course, there are children who are particularly vulnerable, such as oncology patients, very small infants, particularly those in our neonatal intensive care units, and children with other underlying diseases.
Influenza in the patients who are immunosuppressed, including those who are taking drugs that suppress their immune system or who have diseases that affect their immune system, can often develop very severe manifestations of influenza. They have much higher rates of needing to come to hospital and very high rates also, much higher rates of needing intensive care and support for their breathing. So it is really critical that healthcare workers do get vaccinated, because we do know that outbreaks that have occurred in the health setting in particular may actually result from healthcare workers bringing the infection into the workplace.